Welcome to our channel. Switching health insurance mid-year is only possible with a qualifying life event. Follow these step-by-step instructions to transition smoothly when you're eligible. Step 1. Understand qualifying life events that allow mid-year plan changes, including losing job-based coverage, getting married or divorced, having a baby, moving, or gaining citizenship. Step 2. Act quickly, as you typically have 60 days from the qualifying event to enroll in a new plan through the Special Enrollment Period. Step 3. Gather documentation proving your qualifying life event, such as marriage certificates, birth certificates, termination letters, or proof of previous coverage. Step 4. Compare new plans carefully before switching, ensuring your doctors are in-network and your medications are covered on the new plan's formulary. Step 5. Check if you've met your deductible on your current plan. Switching mid-year means starting over with a new deductible and out-of-pocket maximum. Step 6. Time your switch strategically if possible. Consider waiting until after scheduled procedures if you've already met your current plan's deductible. Step 7. Confirm the effective date of your new coverage and maintain your current plan until the new one begins to avoid gaps in coverage. Step 8. Notify your healthcare providers about your insurance change, provide them with new insurance information, and verify they accept your new plan before appointments. Don't forget to like this video and subscribe to our channel.